Hi, welcome back to my channel. In this video, I will be talking about the rest of the reflexes, the facial and oral reflex. So first of all, we will talk about the facial reflexes. So in the facial reflexes, the first one is the nasal reflex. Now what happens is, like if there is basically in this photograph only you can see, just give me a second. If there is see there will be if we stimulate stimulation of the face or the nose with water or local irritants, all right, so it will produce oh, apnea in infants or neonates. So what happens is the breathing is stopped and expiration with laryngeal closure. Plus what you will see is extreme case of, like you will see bradycardia and decrease in cardiac output. Basically if it is if there's a thing that and basically there's a irritation, so the child basically stops breathing only. Now in this important thing to note is that important thing to note in this is ki this is normal, okay, so this is not bad. So what happens is the blood flow to splanchnic muscle kidney decrease but maintained in brain and heart, all right. So this is the first one. Now the second one is the doll's eye reflex. Now it is also called as oculocephalic reflex. Now in this what happens is basically, see, this is normal face. Now the person is turning their head to the one side, right? In this the person is turning their head to the one side, but there is fixation of the eyes, all right. So this is what happens in doll eye. Same as this one, see, here it's normal and then he turns his heads and then there is fixation, all right. So then coming on to the blinking and corneal reflex. Now if we give a bright light, so he will show pupil constriction. So we will see pupil constriction, all right. Now these are just facial reflexes and they are not that important, like doll's eye you can remember. Now we will talk about the facial reflexes which are important from our exam point of view. So in in oral reflexes you have 4 5 which you should know by heart, all right. So starting from the first one which we all know, rooting reflex. Then we have swallowing reflex. Then we have sucking reflex. Then we have cry reflex. Then we have gag reflex, all right. Now rooting reflex, basically when the infant's cheek contacts the mother's breast, it leads to vigorous sucking movement. Now here you need to remember two things: onset, peak, and then disappear. Onset is 28 weeks of intrauterine life, then peak is 32 to 34 weeks of intrauterine life and disappears by the 2 to 4 months of age. Then swallowing reflex, basically when the patient starts eating, basically when the child starts developing the swallowing reflex, it's basically in the 12th week of intrauterine life and it persists through life. in sucking reflex, you have to remember onset, peak, and disappear. So same as 28 weeks of intrauterine life, well established in 32 to 34 weeks of intrauterine life, and it disappears about after 12 months. Now cry reflex. Now cry reflex is one which you should know that it develops as initial as 21 to 29 weeks of intrauterine life. Then coming on to the gag reflex. Now gag reflex develops in 18 and a half week of intrauterine life. Basically, the posterior 1/3 of tongue, this is the ectoderm or endoderm zone. Now touching it induces gag reflex, and gag reflex is a type of protective reflex. All right, so these are the reflexes you should know. Basically, important is rooting reflex, cry reflex, sucking reflex. Just the timelines are important. All right, so this is it. So if you like